Good afternoon, everyone. Welcome to this week's discussion update, COVID-19 webinar. 2 housekeeping items before we get started. If you have questions, please enter them through the Q&A box located at the bottom of your screen, and we will do our best to address those throughout today's program as time allows. Also, please take a moment to complete a survey that will appear once the webinar has completed. We do very much appreciate that. Our attorneys do look at them and appreciate your comments and suggestions for future topics. Now to start today's program, here's Pete Jones.
Thanks, Brian, and good afternoon, everyone. Thanks for being with us here again today. It's a holiday week. I know people are busy, but we wanted to, keep going with our weekly webinar series. We have a little bit of a special program for you today. We thought we would try and offer a little bit of perspective, look back on where we've been, because we've been at it now for really just about 10 months battling the COVID pandemic, and then offer some perspective into the future. And we're going to do that with some of your most common speakers here, some of your friends on our team at Bond who have been presenting on a regular basis, because I thought it would be helpful for them to provide some perspective. Before we jump right in, I would like to provide just a little bit of my own perspective. I've said this throughout, and it continues to be true. I think that people are doing a very good job under very difficult circumstances. We continue to be very impressed by our clients and our friends, how they have managed this situation, how they deal with it. And so I think everyone deserves a little pat on the back, a little lift up for all the good efforts under very trying circumstances. So thank you for being with us again today, and I'd like to turn it over. We're going to start today with Kate McClung. Kate is a repeat presenter for us, of course, on leave issues. There's a tremendous amount going on here. So Kate, could you please take it away?
Absolutely. Thanks, Pete, and welcome everyone. So looking back over the year, we've had several new leave laws introduced. So we had the Families First Coronavirus Act, which provided for emergency paid sick leave up to 80 hours and emergency family and medical leave of up to 12 weeks for childcare school issues. We also had New York's COVID-19 leave law, which applies when an employee is subject to a governmental order of quarantine. And we also had New York pass a paid sick leave law, which isn't limited to COVID. Employers had to start accruing leave under that September 30th of this year, and employees are going to be able to start using that leave January 1st. So that's coming up as well. But some recent news out of the federal government, as I'm sure everyone has heard, the federal government passed a new COVID-19 relief bill. And now that bill did not extend the Families First Coronavirus Act, but it did, interestingly, give employers the option to voluntarily continue providing employees with leave under that bill through March 31st of 2021. So again, to emphasize, it's not required as of December 31st. That's the last day that the FFCRA is in effect and that you're required to provide that leave, assuming that you're covered. But on January 1st, if you want to voluntarily continue the leave, you can. So why would an employer do that? Well, you would continue to be eligible for tax credits through March 31st. Now, it does appear that the leave continues to be limited to those same bank amounts. So that's 80 hours over a 2-week period for emergency paid sick leave and up to 12 weeks of emergency FMLA leave. It's important to keep in mind that the 12 weeks of EFMLA leave comes out of the same bank as traditional FMLA. So if you have an employee who takes FMLA leave for back surgery, is out for 4 weeks, that would just leave 8 weeks left in their bank that they could use for emergency FMLA leave. Also, it's important to keep in mind that the current guidance from the U.S. Department of Labor is if you have, over this time period that FFCRA is in effect, including this new voluntary period, if you have a break in your calendar year, so you're looking at 2 different calendar years of FMLA leave and 2 different 12-week banks, there's still a cap on the total amount of emergency FMLA leave of 12 weeks, even if it's across multiple years. As you're thinking about whether or not to voluntarily continue FFCRA leave, keep in mind that employees may be eligible for other forms of paid leave if you don't continue to apply it, and you wouldn't be eligible for tax credit under those other statutes. So New York COVID-19 leave certainly applies where there's a governmental order of quarantine. New York paid sick leave applies in a number of different circumstances, including where the employee is sick, where their family member is sick. New York paid family leave, COVID-19 can qualify as a serious health condition. New York short-term disability benefits, and New York unemployment. Employees may also be eligible for unpaid leave under FMLA, under the Americans with Disabilities Act, under the New York Human Rights Law. So there's a lot of different leave laws that you have to think through when an employee's out for COVID reasons. Okay, so that's everything on the FFCRA. If you do decide to voluntarily continue it, you may want to document your election in a way such as by implementing a temporary policy that shows that you're making this election, that clearly communicates to your employees what the parameter of that leave is. Another thing that the COVID-19 relief bill that was just passed does is it makes some changes to unemployment. So we saw in the spring a number of changes to unemployment under the CARES Act, and this continues or changes some of those changes. So one thing that the CARES Act did was the Pandemic Emergency Unemployment Compensation Program for employees who had taken unemployment but exhausted it, and they'd taken their full 26 weeks already. This gave them an additional 13 weeks. Well, the new COVID-19 relief bill gives them an additional 11 weeks on top of that. So now the maximum length of benefits is 50 weeks in New York State. The CARES Act also expanded eligibility criteria, bringing in certain types of gig workers, independent contractors, self-employed individuals, some other categories. This latest act continues that as well, and also increases the benefits for them to 50 weeks. Another thing is the CARES Act increased benefits to $600 per week through July 31st of 2020. The new COVID-19 bill adds a $300 extra payment benefit through March 14th of 2021. There's also an extra benefit of $100 for certain individuals who have both wage income and self-employment income, but whose unemployment benefits are calculated without regard to their self-employment income. They're eligible for an additional $100 benefit as well. So those are the most recent leave changes under the COVID-19 relief bill. I'm going to pass it back to you, Pete.
Thanks. Thank you, Kate. I appreciate that. Thanks for the update. We're going to turn now to Adam Masterleo. Adam has some observations here on business shutdowns, reopening. Again, we're going to look back and then we're going to look forward. Take it away, Adam.
Pete, thank you so much. It's been a pleasure to be on these webinars over the past months. And it's been really interesting to watch the government, particularly New York State, and how it's dealt with the coronavirus pandemic, specifically as it relates to what businesses can do, how they can do it, and the changes that have evolved since March. So I'm going to take a little bit more of a historical look. Kate did a real nice job of explaining the current state of the FFCRA. I'm going to kind of step back for a minute and talk about where we were and where we're going. So in March, I'm sure all of you can remember, within a very, very short period of time, a couple of days, we went from a 50% shutdown to 75%, and then almost immediately to 100% shutdown and New York on pause. And New York on pause is where we stayed for several months from the middle of March through May 15th. And during this period, what we saw was the state put out through the Empire State Development Corporation a list of essential and non-essential businesses. I should say a list of essential businesses. The state didn't help us that much by providing a list of non-essential businesses, but they did provide a list of essential businesses. And these essential businesses and this list became critical, because if you were on this list, you could continue operating during New York pause. So what we dealt with early on in the process was businesses trying to figure out, okay, I think I'm on the New York Essential Business List, but it's not clear. What do I do? So the state put in place a process by which a business could make an application to obtain the essential designation. And that was a process that many businesses went through. So we had that going on from March through May 15th. And then on May 15th, we started New York's phased reopening plan. And we saw through the coming months that New York established phases 1, 2, 3, and 4. And the state provided guidelines for each industry, whether you're going to fall into state phase 1, 2, 3, or 4, or the state provided statewide guidelines for industries that didn't neatly fit within one of the phases of reopening. And we saw businesses scramble really to put together plans, these reopening plans that address topics such as social distancing, PPE, screening. I have to write it down. I wrote it down. I know I've talked about it a number of times, but I still have to consult my notes on these issues. Cleaning and disinfection and infection response. So the state gave guidelines to businesses, and the businesses had to put together these plans, and we helped you work through putting together those plans and answer your questions. A lot of times the state didn't give us a ton of time to put together these plans. I can recall, as I'm sure many of you do, the phase 1 guidance came out on May 14th and phase 1 began on May 15th. So you all had less than 24, you in phase 1 had less than 24 hours to put together your safety plans. Now, a couple of things I want to point out that I think still remain important to this day: the essential versus non-essential designation. I know that a lot of clients still have some confusion about what it means. Okay, I'm on the essential business list. What does that mean? Does that mean that my workers can return to work immediately? They can go to work even if they're sick, or they can go to work even if they've been exposed to a positive case? And I think that it's important to point out the essential business designation is going to mean something different depending on the context in which you're using that term. So for example, early on, if you were an essential business, you could keep working. You could stay open, I should say. However, the term essential has a different meaning if you're talking about the travel quarantine requirements that came out later in June and have been modified several times since. That document uses a different definition of an essential worker or an essential business. It's also important to note that the essential designation is going to have different consequences if you're talking about return to work. Early on in the process, there was guidance that specifically dealt with return to work for essential businesses. We believe that guidance was superseded, that March 28th guidance was superseded by later guidance on May 31st that dealt with return to work for across industries, whether essential or non-essential. So the designation of an essential business, while important, it has different meanings in different contexts, and it's important to keep that in mind when you're considering the various issues that have come up related to the pandemic. I should point out that the state also has a separate essential business list for areas that are designated as red zones in the state's new microcluster approach. So there's a separate set of essential businesses for red zone areas. I think that with respect to reopening plans, it's important at this point to go over your reopening plans. And that's something that we, even here at Bond, Schoeneck King, have to do. We have to go over our reopening plans and figure out how they have changed or how they should be changed to comply not only with how things have worked over the past several months, but we also have to update them to adopt the most current guidance, both from the New York State Department of Health. So for example, in your infection response plans, you probably had a set of procedures in place for when somebody tested positive, when you were going to allow them to come back to work, or for someone who was exposed to the virus. Well, New York State has revised its guidance on those issues several times over the past couple of months. So you want to make sure that your reopening plans, your infection response plans, are complying with the most current guidance. Just a couple of days ago, the state updated its guidance as it relates to returning to work following exposure to a confirmed case if you are asymptomatic. And they reduced the quarantine period from 14 to 10 days. So that's something you might want to take a look at in your infection response policies. Make sure that they're current and up to date. Now, over the past several months, we've also seen significant changes in employee leave issues. Now, Kate talked about the specific employee leave statutes, paid leave statutes that are available or were available to employees, but there are a number of other issues related to employee leave that have become very important, such as when an employee can work if they test positive, if they're exposed, or if they're symptomatic. Under what circumstances will you have to send somebody home? Under what circumstances do you have to, or can they return to work? And when are they entitled to paid leave? So we've seen that change over the past several months. And I think it's going to be important going forward to keep track of and stay on top of what leave laws are in effect, what guidance the state has put out, what zone you're in, and what restrictions are placed on your business currently. Now, one thing that I saw several questions in the Q&A about whether New York State's COVID leave continues, and the answer to that is yes. So while the FFCRA technically ends on December 31st, the paid leave benefits technically end on December 31st, New York's COVID leave law continues. So you are still required to provide that leave when there's a quarantine order in place. Now, Pete, there are so much more I could talk about. One final quick issue that I wanted to touch on was the travel guidance, because I know that the historical context of the travel guidance is really interesting and really important. When the travel guidance first came out, we were dealing with lists. I'm sure you all remember every week on Tuesday, waiting for Katie Anderson to update you about what states have been added to the list. And so what states your employees could no longer travel to without quarantining. We saw that change. We saw the state get very tough on international travel and say that anyone who travels internationally to level 2 or level 3 countries now have to quarantine for 14 days, no exceptions. And then we saw on November 3rd, the most recent guidance come out where the state acknowledged the difficulty really of enforcing this list-based approach, gave employees and individuals the option to test out. And so I think that it's going to be going to be very important as we go forward to continue to monitor that guidance, continue to try to figure out what guidance applies to you, how it has changed. And obviously we're going to keep letting you know, we're going to keep our finger on the pulse of the state. Katie's going to give you the weekly updates and let you know how the governor's changed his mind this week. So thank you for being with us over the past several months, and we'll be here for you going forward into the future. Thanks, Pete.
Adam, thank you. That's a good summary of where we've been with some nice nuggets on where we're going. So let's turn now to Katie Anderson. Katie's going to do the same thing here. I think she's going to look at the executive orders and kind of bring us full circle over the last 10 months. Katie?
Here we go. We've got no worries, always a lot to cover on my end. I thought, this might be a great opportunity to go back and take a look. They were the first confirmed COVID case in New York was March 1st. On March 2nd, the governor sent a bill to the legislature that gave him sweeping powers, and that bill was signed on March 3rd. It expires on April 30th of 2021, and I'll talk about that in a little bit more when we're looking at where we're going. And a simple majority vote at any point in time can override any of the executive orders. That has not happened yet, and I am not confident, or I don't really think that ever will. This is the text.
I think we're having some problems, Katie, with your audio. Why don't we
Oh, we can't.
why don't we take a break
Yep.
real quick, and then why don't we go to Hermes, and then we'll see if we can reconnect with you. Sorry about that, everybody, and sorry, Katie, but this is the COVID era. This is what happens when we're all trying to connect remotely. So Hermes, you had a few thoughts. Why don't we turn to you, and then we'll go back to Katie in just a second.
I do. Thanks, Pete. Katie, thanks for stepping aside. I'll be fast. Happy holidays, everyone. I have, I think, largely an optimistic report to give to folks today. First, before I talk about where we are with the vaccines, I want to mention one thing that Adam was talking about in terms of the new guidance from the health department requiring a shortened quarantine period. I think this is a very significant piece, and it shouldn't be overlooked. We all need to be aware of this. The quarantine period has been 14 days. Now, this is different than isolation. Remember, isolation applies to those who become ill with COVID. For those who've been exposed to someone ill with COVID, the quarantine period will now be a minimum of 10 days instead of 14 days, so long as the individual is asymptomatic. If an individual shows symptoms, it's a 14-day period. We're talking about isolation. But if it is someone who is asymptomatic, it's a 10-day quarantine period. For those of you in the healthcare field, especially nursing homes, assisted living facilities, that period of time is a 10-day quarantine, but the individual cannot come back to work until the end of the 14th day. So there's some heightened concern about nursing home residents. We've certainly seen the problems there, but that's that's all to the good. It seems to be reflecting some knowledge that most people, if they're going to become ill during a 2 to 5 day window after exposure. There are still some who become ill after 10 days, but that's really very few. So where are we on vaccines? Right, we've got two vaccines now, the Moderna vaccine and the Pfizer BioNTech vaccine. The Pfizer vaccine is a little more difficult to distribute, but that is the primary vaccine right now. Vice President-elect Kamala Harris got the Moderna vaccine this morning on television. So that's rolled out as well. The logistics of vaccination remain difficult. Thus far, there are 11 million doses between those two vaccines available in the United States, and 2 million people have been vaccinated. The projections for December were probably overly optimistic. The projections were as many as 20 million people would be vaccinated, getting their first dose by the end of this month. The end of this month is 3 days away. That's not happening. So let's talk about where we may be and how long this will take. If 20 million Americans receive their vaccine per month, right? That may be a heady number, but if 20 million Americans receive that vaccine per month, and the vaccines are available, the Moderna vaccine is available for those over 18. The Pfizer BioNTech vaccine is available for those over 16. We've got about 260 million Americans or so who fall into that category, who are above those ages. So if it was 20 million vaccines per month, that's a 13-month period of time, right, to get everyone vaccinated. Now, we know we're not going to have everyone vaccinated, and frankly, we don't need to have everyone vaccinated. The estimates I've heard are between 75% and 90% of the population needs to be vaccinated. That means we can shave 3-4 months off of that list, maybe as many as 5 months. So we're talking sometime around August, probably for when we would be at the spot when most everyone has to be vaccinated. We were aware, and we've had some discussions about this regarding mandatory, whether vaccines should be mandatory, that there are some people who will not want to be vaccinated. Thus far, those numbers seem to be coming down. More people are stating a willingness to be vaccinated. More people in healthcare are stating a willingness to be vaccinated. I saw some numbers this morning about individuals in nursing homes, and the numbers in nursing homes are very high so far in terms of those who are getting vaccinated, over 80–85%. And that's all becomes very important as we talk about the transmission of the disease, because one of the things we don't know about the vaccine is, or the two vaccines that are available right now, is we don't know whether someone, once they are vaccinated, can shed the disease, right? We've heard that term before about shedding the disease. Those people who would can simply infect others, right? And one of the biggest issues that we face, and one of the great difficulties in this COVID epidemic, is asymptomatic transmission. The asymptomatic transmission is why the disease exploded in New York in March and April. Right? By the time the governor had been given his emergency powers on March 2nd, as Katie was mentioning, the disease was among us, right? It was there and it was not known. So we had this, we have that same issue right now. Is one of the things we don't know about these vaccines, and they're still being studied, is while the vaccines appear to be very effective for those who complete the inoculation, and for both of these vaccines that are available as 2 doses, 21 days for the Pfizer vaccine, 28 days for the second dosage for the Moderna vaccine, they will be 90–95% likely to be safe from the disease themselves. But we don't know if those individuals can shed the vaccine. It's expected that they will not, or that their ability to transmit the disease will be diminished. That becomes very important, and is one of the reasons why we don't have to have 330 million Americans vaccinated, because if I get the vaccine and I am less contagious, there is less risk of transmission. We've heard the governor very often back in April and May, and we continue to hear others talking about this, that the rate of transmission has to be below 1. Right? Someone has the disease, they infect fewer than one other individuals, the disease begins to shrink. When they infect more than one individual, the number of people infected grows. If the optimistic views are accurate, as people are vaccinated, we will see a shrinking transmission, because it will not be simply the person who's vaccinated, but once the person is vaccinated, they will be less likely then to transmit the disease to someone else. And that means that even while we get past, or while we start to approach the numbers of people you want to see completing their immunizations, we could be in a position maybe in May or June where there's less need to close businesses, right? There's less need to keep people apart. We don't know that yet at this point, right? And I'm not an epidemiologist, I'm not a doctor, I'm only a lawyer. But there is some reason for optimism that we could be in positions that things could begin to reopen. Let's not jump the gun on that. Forget the New Year's Eve parties. You know, you're gonna have to do with Ryan Seacrest. That'll have to be enough. But we could be in positions where we see some things that could be very helpful. As if the vaccines continue to get out, if we get past the logistical issues of getting people vaccinated, and this is different than a flu shot. People have to be monitored, and once you get the Pfizer vaccine, you have to be watched for half an hour, right? And people may have side effects once they get that second dosage. Expect people calling in sick after they get that second dosage. But we'll see how that all works through. Those really are the biggest pieces here. It's the unknowns. One of the, to use the great Dick Cheney line, one of the known knowns is that the Trump administration has negotiated to buy 100 million more doses of the Pfizer vaccine for delivery around June. Now, since they're talking about doing that in June, that suggests we don't expect to be done vaccinating people, right? 100 million doses means 50 million more people to be vaccinated after June, right? So this is a fairly long time frame if we are looking at it from where we stand today. If we look at it from where we stood back in March, when there was no vaccine and the discussions were that no vaccine had ever been developed in faster than a 4-year time frame, this is all still remarkably quick and all a reason for optimism. Now, one last thing I want to mention in this in terms of what we don't know is we also don't know how long the immunization from any one of the particular vaccines will last. So we don't know whether people will need to be vaccinated again next year, right? The flu vaccine, and I hate to make comparisons with the flu because this isn't the flu, but flu vaccines have to be taken every year. Right? We don't know whether these vaccines will last for 1 year, 2 years, 5 years, right? And there's great variance among vaccines, right? For all the parents out there, right? You think of the vaccines you've gotten your children as in their infancy, right? And you're done. But some of those you're not done. Some are booster shots, right? The tetanus shots that people get once every 10 years, right? I get a smallpox vaccine when I was a baby. I haven't been back for that a second time. So there's some things, vaccines work in different ways, at different levels. We don't know where we are in terms of the continuing efficacy, but we've got great reason to be optimistic that we can, we can't see the end of the tunnel, but we can see the light beginning to go through the tunnel. Pete, I'm complete.
Thanks, Hermes. Appreciate that. Some good news in with the not so positive situation.
Oh, Pete, there's one thing I wanted to mention. I just this very, very quickly. The governor this morning issued an executive order because while we've seen people who've said they don't want to get the vaccine, there's also some people who are interested in line jumping. The governor's issued an executive order to really slap down on that line jumping. So if you're a healthcare worker, be aware of that. When people say, please, 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 say no, no, no. I apologize for jumping back in, Pete.
No worries. Useful information. I think we've got the audio solved with Katie. We're going to go back to Katie on a phone/video connection.
All right. I think we do. Can you hear me all right? All right. The wind is howling, so the Wi-Fi might go out, my video might go out, but my phone will not. So we'll carry on. As I was saying, these executive orders, the power given to the governor is extremely broad, and it goes out. Remember, the expiration is April 30th. So if you look at all of these things right here, there's so many different reasons that the governor can issue an executive order. But remember that those directives must be necessary to cope with the disaster and provide the procedures reasonably necessary to enforce such directive. No executive order at this point has been challenged for going beyond that statute. I'm going to be using an article that Hermes had written for Bloomberg, came out 2 weeks ago. And it really this lays out exactly what the limits are on the governor. The limits on the governor's power at the moment, the first one, the biggest one, is public acceptance. He won't be able to continue doing this, to continue changing all of these laws, so long as there is no public acceptance for what's happening. Statutory limits, this is big. It has to be, again, that language, necessary to cope with the disaster. And each executive order expires in 30 days. So that's why we continue to see the reissuance of executive orders extending 40 other executive orders. That will continue to happen. And, the analogy that Hermes uses in this article is really great. He says the governor couldn't mandate that everybody needs to wear Yankees uniforms or Yankees caps. As a Mets fan, I would say never. That's not something I would stand for, but that is correct. The governor could not do that. That wouldn't be something that would go towards fighting COVID-19. And finally, there are constitutional limits. We've seen challenges to the executive orders. The ones that have seemed to work the best have been on with the First Amendment for religious freedom. Those have been the ones that have pushed back the most on these executive orders. But beyond that, there's really, he has a ton of power at the moment. And, those are, you want to constantly be looking at that. So where are we currently? And this is when I was looking through the executive orders this morning to prepare this slide, because I knew another one was coming out today, so I didn't want to do it yesterday. You've had hundreds of laws that have been suspended or rewritten, right? Everything you have from commercial evictions, you've stopped that, mandating face coverings in public when you can't have social distancing, to allowing businesses to hold meetings virtually. These have changed so many things in our society, in how we function. And that is something really important that, going forward, what's going to happen to all of these changes? Will the legislature, for example, go through and pass a law that would allow businesses to hold their annual meetings virtually? I wouldn't be surprised if something like that happens. Looking at, there were 90 executive orders thus far. There's still a little bit more time left in 2020, but 90 executive orders issued this year about COVID-19 alone. 26 were issued in all of 2019. It's really been quite a remarkable year. I mean, before COVID hit, I had never taken a look at an executive order. And, now I'm really looking at an executive order all the time. So this next slide, it goes through, and you might have lost my video, but that's okay. I'm still on the audio. Looking at where we're going. The executive order legislation expires on April 30th. Biggest question here is, will it be extended? Going and looking at what the legislature is going to do. The legislature, there are now two supermajorities. The Democrats have a supermajority in the Senate and in the Assembly. That means that if the governor vetoes a bill, the Democrats can vote with their conference to override that veto, and they have enough numbers to do that. The question is, will they do that? Will they be willing to counteract? What will really be the question here, and I know I'm asking a lot of different questions, but the biggest thing is, will this provision that gave the governor all of these powers be put into the state's budget? The state budget is usually this enormous bill that passes, and it is, if that is slipped into the budget, that would be one way I could see that being extended. But, based on Hermes' timeline, we are, hopefully coming to the end of this soon, but I'm not sure that we'll be coming to the end of it by April 30th. So with that, Pete, I'm done. I thank you all for your patience with some technological difficulties today.
Katie, thanks. Before I let you go, though, interesting, your observations about some things that will perhaps, maybe even likely, survive the pandemic because they've made life easier, or they bring us into the modern age. Not the public health pieces. Obviously, those are related to, responding to the disaster. I think that was the language. But some of these things that have made, sort of virtual meetings and electronic meetings more prevalent, and perhaps been very effective. So interesting. We'll have to wait and see what happens there. And that second point you made, I think, is really a critical one. What's going to happen, on April 30th? I mean, where will we be, and will there be an extension or some sort of additional legislation?
And I think, Pete, when you're looking at that as well, will it be that the legislature takes the initiative and passes laws to, that would alleviate the need for a lot of these executive orders, like the virtual meeting one? I get emails every time that's going to expire. Will that be, is that coming to, be renewed or whatever? And if they're willing to pass certain things, then, we may see his power be curtailed, but I'm not sure that we're gonna necessarily see that.
Okay, excellent. Thank you. Thank you for the update, and thank you for all the updates. All right, we're going to turn now to Kate Reed. Kate is going to give us a little bit of a, the same kind of perspective on the school issues, where we've been and where we're going.
It's been a really exciting, I use that word somewhat tongue in cheek, but it has been an exciting year to be a school attorney, an exciting year to be a school official, to be the parent of school age children, to be the employer of school employees. And generally, I think we've just seen how central schools are in the operation of our society this year, as we've appreciated the critical childcare services that they provide, the meal services that they provide, transportation, and so on and so forth, and the essential nature of the services that our schools provide, in addition to educating our children. I think the point that Pete and Katie ended on regarding some things that may just stick with us after the pandemic really applies in the school context as well. As we were doing this little retrospective, one thing that occurred to me is this concept of snow days. So in the old days, of course, we would have here in upstate New York, we have wonderful fluffy white snow all over the ground when we woke up this morning. And this may have generated a snow day, which is a time-old tradition where children wake up and are told that they don't have to go to school. They can go, snow sledding or building snow angels, et cetera, outside. This year, the New York State Education Department started a pilot, which is essentially permitting public school districts to eliminate snow days in favor for remote learning, being that because schools were required to adopt protocols for remote learning to respond to the COVID-19 crisis, all schools are currently capable of oscillating between in-person instruction, remote instruction, and back and forth really pretty fluidly now. Does that eliminate the need for snow days? It's something the New York State Education Department is questioning. If there's too much snow on the ground, can kids be now just plugging in remotely to still access instruction on days when they can't attend in person? I think we're going to see, parts of that technology really changing the way that traditional school is operated. I think we're going to see that a lot of the technology that's been developed and exploited over the last 6 to 8 months is maybe going to stick with us as we look at serving children with disabilities. Some of those technologies have actually made services available for students who previously did not have access to them in a way that's been really remarkable. Where did we start this year? Well, we started on March 17th with a statewide school closure order by the governor, which coincided pretty closely with that order that Katie was reporting on, that got us started following the governor's receipt of wide executive power to address the COVID-19 pandemic. Schools were essentially closed, as I said, by state order of the governor through summer of 2020, a truly unprecedented situation that created myriad problems for employers, parents, caregivers around the state as they moved to try to pivot to respond to this unavailability of childcare. What is interesting now, of course, is that we're seeing some I don't want to say backtracking, but definitely some revisioning and revisiting of concepts that have led us through the pandemic. Principally, although we had a priority of school closure at the beginning of the pandemic, now the governor has kind of moved away from that notion. The most recent guidance we have as of 12/7 really emphasizes that the priority of keeping kids in school, not just because of the economic benefit and the benefit for folks that are working to have kids in school, but also because the testing and contact tracing that had to be done during the fall has revealed some very interesting things about the transmission of the disease in school. And what we've learned is that there really isn't a lot of transmission of COVID in school. For whatever reason, maybe kids are better at conforming and following rules than adults are sometimes, but our children are not transmitting COVID in school. And as a result, the governor was quick to respond to that, to eliminate a lot of the restrictions that were in place in the orange and red zone original guidance. So as of 12/7, if you are in an orange zone or a red zone as a school, you may continue to be open, provided you engage in testing activity of a minimum percentage of your population, 20% for orange zones and 30% for red zones. Big change from where we were in October. Another practical question that has arisen, though, is that even though there is no statewide school closure, you may be noticing in your communities that your schools are closed, whether it be for a period of a few weeks, or some schools, I just read this morning, Rochester City School District will be closing indefinitely, so likely through the rest of the school year. What's accounting for that? Well, it's a number of factors. Principally, even though COVID is not spreading in schools, community spread is really impacting the ability of school districts to maintain continuity of staff and to maintain students in school. Parents who are traveling, employees who are traveling, people who are being quarantined based on close contacts with COVID positive individuals. All of those folks need to quarantine or to isolate, as Hermie stated. And as a result, there's simply an unavailability of folks to actually operate the school district. So a lot of schools, particularly in the small rural areas, are having to close because they simply don't have the personnel present to be able to keep their operations going. Where are we going? It's as I said, been a whirlwind year for schools and everybody associated with them. I think the next frontier is going to be the vaccine issue, which Hermie's already alluded to. I would be reading tea leaves or crystal balls to try to predict exactly what's going to happen in the school arena, but I've never shied away from doing that in the past, so I'll try a little bit now, which is, I look at where we are currently and the legislative framework we have. We have 2164 of the public health law, which has, for a very, very long time, compelled certain mandatory vaccines for attendance of children in school. For a long time, there were 2 exemptions under the legislative framework for opting out of those vaccines. And this is for those traditional communicable diseases, as Hermie stated, measles, mumps, rubella, varicella, et cetera. And traditionally, you could get out of those vaccines as a school child if your parents had a sincere religious belief in opposition to vaccination, or if you were medically incapable of being vaccinated. Prior to the whole COVID pandemic, there was the measles pandemic, which happened down in Rockland County, which resulted in the legislature in June of 2019 repealing the religious exemption and sending a strong message that really all school children need to be vaccinated in order to attend school. So, what that means in terms of the COVID vaccine, we have very, very strong case law in New York State and from our federal courts that supports mandatory vaccine of school children as a condition of attendance in school, unless they are physically, medically incapable of being vaccinated. I think it's too soon to say that the legislature is going to act to make COVID vaccination a mandate, because the science just isn't there yet. The FDA final approval is not there. These are still all conditionally approved vaccines. So I do not see the state legislature amending 2164 of the public health law to mandate the COVID vaccine until some of that uncertainty has been resolved. But once that uncertainty has been resolved and the science catches up, I would expect that the next frontier is going to be looking at vaccinating school children as one of our lines of defense to the COVID virus in 2021 and beyond. I think we're going to be looking at more creative ways to keep kids in school so that parents can go to work. I think that we're going to be looking at ways to minimize closure and to continue to be able to get our schools to be the testing sites that they need to be able to keep the rest of our society operating. So that's it from a really high level. I know there's a lot of minutia involved in school operations right now as well, but that's kind of the retrospective piece.
Thank you, Kate. And thank you, everyone. Appreciate you being with us here today. The new year is upon us. You have our best wishes for the new year. Hoping that you have a safe, prosperous, and healthy new year from us at Schoeneck King. Everybody, please take care, and we'll see you back here next Tuesday.